I want to introduce 3 postoperative care tips for drain management. In other videos, I described what drains are, where they're placed, what their purpose is, how long they have to be there for. But today we're going to talk about a lot of what the care is for a surgical drain and what that entails. So to recap, a surgical drain is placed in an area that has a potential space of building fluid. This drain then goes externally outside the body through a small poke hole about the width of a fingernail. It then goes into a collection bulb or a drain. That's then quantified, and then it's your prerogative to then empty it out and discard that fluid. So those 3 tips are making sure that the area itself, including the drain, are very clean. That's number 1. How that's done is by making sure that the area that the drain comes out from the skin is held very tightly to help prevent its movement. Remember, where that drain exits the skin, it's anchored in by a suture. That helps prevent the movement of the drain both in and out. So by you holding that drain exit site close to the skin, you're going to help prevent any tugging movement that could be uncomfortable. With your other hand, you're going to have a clean cloth that has alcohol on it. I want you to get some alcohol, place it on top, dab it, make sure it's nice and moist. And then with the dominant hand, you're going to be holding that drain close to the skin to prevent its movement. And with your other hand, you're going to be pulling that drain. Remember, these drains are stretchy. You're not going to break it. I also don't want you yanking it hard, but I want you to do a nice and slow motion on this drain that's going to help clean this drain, as well as strip the fluid inside the drain. Sometimes fluid can build up and become a little bit firmer. You can have small clots or things like that, or proteinaceous materials inside these tubes, and I want that fluid to come out with you pulling or stripping that drain. As you move further out, I want you to move that non-movable hand closer. You're gonna let go here, come and grab closer to where you left off. Again, hold hard and then pull out again. And you're gonna do this all the way up to the collection bulb. You'll actually see how much material and fluid will gather in your bulb itself. Now, that was number 1. Number 2 is the emptying of that fluid out from the bulb itself. As this bulb gets more and more full, I want you to drain the fluid out and record its color, character, and amount. So remember, this fluid is then going to be discarded. Don't forget to write this and bring this to a log in clinic, because that's going to help quantify when this drain is going to be removed. The third thing is to make sure that drain is always on compression. How that's done is that the bulb itself, the little collection, looks like a little grenade, has a little cap on it. That cap comes off. That's how you empty it out, like we just talked about. But once that's done, I want you to squeeze this and then put the cap back on it. You'll notice that this suction will be on when this bulb is compressed. While it's compressed, it creates like a vacuum seal. So the tube that's inside and the subcutaneous layers of your body is now going to be on suction, and it's going to help drain and evacuate that fluid. Whenever this bulb opens back up and it's not on suction anymore, even if the fluid isn't built up in there, I want you to take that top off, squeeze it down back on compression, and put the top back on. That's how you take care of your drain in 3 easy steps. Thank you very much.